I'm joined by Andy Topping, who is the Chief Scientific Officer at Fujifilm Diosynth Biotechnologies. Andy, it's a pleasure for you to be here.
Thank you.
We're going to talk about gene therapies, I think, to start
Okay.
with. I guess it's been a productive couple of years for gene therapies, but how far has industry progressed in realising the commercial value of these therapies?
So I think it's early days for the gene therapies in terms of showing that they can really become medicines. But the promise is so great, to really have curative products rather than simply managing symptoms or moderating disease. It's such a huge prize that I think we're probably at a point where we have got to a kind of tipping point, if you like, with those products. The trials that people are beginning to produce data for from the likes of Spark and from BioMarin are so spectacularly good that on top of the kind of concept of what these products hold as a prize, hundreds and hundreds of companies and products and being put into clinical development. So a way to go to show that it's all really going to come to fruition in the end. But what a fantastic start, really.
Did the free approvals last year, towards the end of last year, did they really encourage industry to pursue these developments, or were they just kind of the first free that broke through?
I don't know that industry needed any encouragement, to be honest, to continue the development. I think that they're part of that journey, aren't they? Part of that stepping stones to get us to a point where real mass diseases can be tackled by these therapies. And of course, at the moment, people are quite reasonably cherry picking, if you like, the ones which are low dose or have very low incidence, because some of the manufacturing challenges are so high for things which are very prevalent or require very high dosage. So I think it's a stepping stone. It's a nice proof of concept. I think it will do really well in terms of convincing people that there's actually a financial case for this, and these can become valuable medicines for the companies that are developing, as well as valuable for society.
So financial perspective tick, development tick, but manufacturing capabilities. Are there enough capabilities out there to fulfill the current demand? And I guess future demand?
At the moment, there probably isn't quite enough. CMOs like ourselves are running a little bit to keep up with the number of new products and new companies who are looking for, especially early phase services. Early phase manufacture for gene therapy products it isn't really manufacturing. It's lab processes which are done in a different environment. They're such small scale. The technology that's used is very kind of lab based, really. And that gives some challenges around how you're going to make enough of these products, even for early clinical development. And we, just as other CMOs, struggle a little bit to keep up with that constant need for more small-scale development capabilities and manufacturing capabilities.
So that's how Fujifilm got into this space, on a sort of lab-based scale. When was that? When did Fujifilm really look into gene therapies?
In 2014, we acquired a company in Texas, Kalon Biotherapeutics, which were a viral vaccine company. That now has, although we still support viral vaccines for pathogens, more and more we're using those facilities now to produce gene therapy vectors, because the technology is very similar. Obviously, we're dealing with similar separation, similar analytics, whether they're prophylactic vaccines or gene therapy vectors.
So 2014, were you ahead of the curve?
Were we ahead of the curve? I think we're kind of with the curve. I think there weren't too many products before that, and of course, obviously, it's tricky for a CMO to make the investment and put assets on the ground before the products turn up. But equally, we don't want to wait till we've got too many products to service before we put the assets on the ground. So it's a little bit of chicken and egg, as it always is with these things. I think it's proven to be a good strategy in terms of putting those facilities on the ground. As we talked about a few minutes ago, it is a struggle at the moment to keep up with demand in terms of products that are coming through.
And this new Texan facility it opened officially at the beginning of the year. Is that correct?
Well, there are two facilities in Texas. So the gene therapy
gene
one has
therapy
been running
one,
that's been running for a little while. Actually, we opened a MAB manufacturing factory at the beginning of the year.
And that was the old Kalon
Yep.
site. How easy was it to convert a site that was predominantly used to make viral vectors for vaccines to make viral vectors for gene therapies, make gene therapies?
So actually rather simple given how the facility was set out in Texas. So it's the facility there uses a series of mobile clean rooms. So individual clean rooms set in a large grey space. We have 14 mobile clean rooms. So they can all be VHP sterilised. Because of the nature of the processes, both for vaccines and for gene therapy, there is no stainless steel. Everything's plasticware, everything's single use. So actually reconfiguring the facilities from the point of view of carryover and things like that is actually rather simple. And actually the technology we use to manufacture the products is also very similar. So typically adherent cells, Vero cells, HEK cells, grown in hyperstacks and that kind of plasticware. And then a separation of the virus particles from the junk.
And so I'm looking forward to the next few years at this site. Are there plans to sort of scale up production as gene therapies move through the clinic?
Yep. So we have a new facility which actually takes us from the small 14 MCR facility we have, which is really dealing with multiple small-scale, early-phase products. We have a new facility that's designed for late phase and commercial. So that either allows us to scale out adherent cells or hopefully allows us to intensify the processes by switching them to suspension culture. And I think one of the real challenges for all the gene therapy manufacturing is how do you make enough stuff? And if you're using adherent cell technology and you're attempting to scale out, the back of the envelope calculation quickly becomes very difficult if you want to treat beyond a few hundred patients maybe. And certainly if you want to treat tens of thousands, it becomes just impossibly large to imagine how you would do it. So making that step to suspension culture, and we could support up to 2,000 litre suspension culture in single-use SUBs in that facility in Texas.
And you recently, I think you named RegenX Bio as a customer. Just trying to gauge what sort of how much capacity utilization you've got going at this facility with such demand in the space and with them as a customer. And are you going to be investing sooner rather than later?
Yep, I'm sure we'll be investing sooner rather than later. But some of it's investing in facilities, but some of it is investing in technology. You know, we could make a lot more material and we could support a lot more products if we could intensify them. You know, having even early phase processes which are using such laborious manual processes with adherent cells and the hyperstacks is very challenging and takes a lot of resource, takes a lot of space. Actually being able to intensify those, so for instance at the moment we run some processes which use 50 hyperstacks for a batch. So this is quite a complicated manual handling issue, filling them, emptying them. We have to have reinforced incubators and things to hold these. And actually, if we could switch to a suspension cell culture, we could get 5 times more product from about a 2-litre suspension culture of the same cell line.
You mentioned 50 hyperstacks there. Do you find that the vendors of such equipment you're kind of liable to their production levels?
Yep.
Are you finding any shortages due to the high demand in cell and gene
absolutely.
therapies?
So of course you're absolutely right. You know, with lots of our facilities, we pay a lot of attention to the supply chain for the single-use materials that we use because we become very dependent on them, whether we can use our facilities or not. Currently, hyperstacks are a real issue for us and for other people around the industry, which I think just speaks a little bit to this explosion of early phase manufacturing with these rather cumbersome lab-style processes rather than real manufacturing processes, which I think has taken Thermo as much by surprise as anybody else.
Well, I guess it's a whole new frontier, isn't it? So no one's quite prepared for what's needed and this whole influx.
Yeah.
Okay, Andy, I've got one last question I'm hoping you can talk very briefly about. It's kind of related, but Irvine Scientific, I think today it's been announced that the acquisition has gone through. How big a deal is this for Fujifilm and its biomanufacturing capabilities?
So I think, obviously it's early days for to see how Irvine gets integrated into the Fujifilm family. But I think it's a big deal for two reasons really. One, I think, is a statement of intent for Fujifilm. This is a lot of money to spend acquiring a company to add to that kind of life sciences capability within Fujifilm. So I think it's a big statement of intent. And then I think at the more logistical level, I think it is part of that back integration of the supply chain. How do we make certain that we aren't so dependent on people we have less control over for these important materials going into our processes?
So it really complements your offering and gives you a bit of security as well.
Absolutely.
Okay, that's fantastic. Well, look, Andy, it's been a pleasure talking to you, and I can't wait to hear more from all these future investments at Fujifilm.
Great.
Thank you.
Thanks a lot.
Very quickly, once again, if anyone does have a question, we do have a couple of minutes. But we've got a very quiet crowd today, so Andy, thanks again.
Thanks a lot.
Cheers.